Good afternoon, everybody. Thank you very much for asking me to speak. And first of all, apologies, I arrived late yesterday. There was a good reason. Yesterday being World Water Day, as of course we all know, there was a walk for water organised around the world, and about 300,000 people were walking in different countries to mark the fact that in the developing world, women walk for many hours to collect water, and to mark this important day and to say we need to do more. And our Secretary of State joined us for the end of that walk, so that was where I was. So I want to try and give a fairly pragmatic NGO view to talk about what we hold really dear, which is the right of everyone to have accessible, adequate and affordable, safe water to drink and a place to go to the toilet. And as was said, I'm going to look back briefly and I'm going to look forward. So some reflections on the past and also some thoughts on the future. WaterAid as an NGO focused entirely on safe drinking water and improved hygiene and sanitation is 30 years old this year. And we came about because the UK water industry, which was public at that time, went to the very first UN Decade of Water meeting and were really outraged to hear that still people were dying because of lack of access to safe water and sanitation, and said, what can we do? And they came back and set up WaterAid as an NGO, and they got behind them the British water industry and the public by sending out with the water bills that everybody in the UK gets some information about WaterAid's work and what was going on in countries where people didn't enjoy water out of the tap, as the UK public did. And they also provided engineers to go out to South Asia and Sub-Saharan Africa to work with local institutions. So that was how we were born. Now, as you probably know, the UK water industry is now privatised. However, that support of WaterAid and the work that we do has continued, because that commitment and that passion about water and sanitation for all has carried through. And as I think you might have heard yesterday, our founding director, David Collett, he came up with a wonderful document called the Ethos document, which spelt out the vision of WaterAid and the values and the way we were going to work. And I think, I was talking to John about this last night, one of the hallmarks of a successful organisation, I think, is when that carries through over the years. So for 30 years, really, that's driven us, that passion, that commitment, those values. But of course, the world around us has changed enormously. And so one of the ways that we always work, right from the beginning and in that document, which I think was quite different at that time, was that the idea was to invest in local organisations. We didn't go in as an NGO saying, right, we're going to fix this problem, we're going to help, we're going to dig holes, we're going to get people water and sanitation. We went talking to local organisations and saying, how can we work with you to support your work so that there can be sustainable solutions long-term that will be to the benefit of communities. And I think that was really quite an unusual aspect of WaterAid's early days. Now, of course, things look quite different. The world's changed enormously, and we have a new global strategy taking us through to 2015, which is looking at the problems of rapid urbanisation, people moving, as we've heard this morning, into the peri-urban areas, into informal settlements. How do we try and support organisations working in that context? And how do we both promote the rights of everybody to get access to services, but also support those who are demanding services and are asking their local institutions to provide them and to hold them to account. So both the supply side, but also the demand side. I'm also looking at the importance of working across sectors. Again, we're always saying this in the water and sanitation sector, but we're apt to talk to ourselves. And we know that water and sanitation are integral to the realisation of other Millennium Development Goals, getting good health and education, etc. And I think the other thing that we tried to spell out in our recent strategy so we're now working in 23 developing countries, is that the work should look very different depending on the context. So we'll support organisations whose work may be service delivery, it may be about demand and citizens' action, it might be about policy, it might be about aid flows. Whatever's going to have the greatest impact in really trying to unblock some of the difficulties and address some of the reasons why people aren't getting these services. So while service delivery does stay at the heart of what our partner organisations do, so we invest in partners to deliver services, we also know that however much WaterAid scales up, of course, an NGO is not the answer to this problem. And so we're increasingly trying to work with all the other actors. Because one of the things that I've felt about the discussion we've been having is that I guess we try and work in a non-ideological way. We work with people that are getting water and sanitation to folks. There's not a particular method. We don't think there's one answer. It just depends on what suits in that particular country context. And also supporting, therefore, organisations that are trying to influence national governments and also trying to influence the global environment. So influencing through good research and through policy and advocacy is really integral to what we're doing these days. And obviously the significance of Delhi, I think, was great because for the first time we were talking about equity and universal access. And that principle of really ensuring that everybody has a right to water and sanitation is something that WaterAid has particularly been promoting with local organisations over recent years. And those of you that heard the presentation from Louisa and others this morning, John, about how do we actually look to overcome barriers that stop many of the marginalised and the poorest members of our society, or the communities we work with, getting services. So really trying to include older people, disabled people, people with HIV and AIDS, people from castes that are discriminated against. And that's become much more mainstream in our work. But the other bit of equity is about equitable distribution of resources and making sure that communities most in need are the ones that are being targeted. Of course, when the Millennium Development Goals came along, we felt that was really important in terms of focus on the poor. So it was really about trying to change the lives of the poor. However, of course, it was about 50% of people in poverty, getting them out of poverty. What about the other 50%? So the issue of equity wasn't there, but at least it was a target to really try and achieve some change. We were very pleased when the UN last year declared water and sanitation as a human right. We do think that's part of the many tools and approaches that can be used to actually promote change. And it's not about free access to water, but it's about access, and it's about access for all. And we felt that was a really significant move forward, and one that we feel civil society will be able to really capitalise on. We're talking about equity. Unfortunately, the amount that's invested proportionately in water and sanitation in comparison to other sectors is decreasing, so in terms of health and education. And we've also looked, as many of us had, at studies of where investment has been made. Has it actually reached the poorest and the most marginalised communities? And often that's not the case. And certainly in some of the studies we've been doing recently with the World Bank, that's come out very clearly. And again, as those of you would have heard from the presentation earlier this morning, we believe that is about much better targeting, and it's about actually thinking about the barriers during the design phase of the work, but also including people in that so that their voices are also heard and their needs. And we were really pleased that at the Millennium Development Goals Summit last September, 10 years on, that whole issue of equity was being talked about much more, not just achieving the goals, but what about equity? And the other aspect that came out very clearly was the one about integration. You can't just look at water and sanitation, you can't just look at health, you can't just look at education. They all are interdependent and interrelated. And that was something that really needs to be taken forward. The trouble about that, I think, is that in that desire to achieve in the individual MDGs, Millennium Development Goals, that might unwittingly work against this need to look integrally, because there is a real push to try and achieve on individual targets, that whole silo issue. As you know, WaterAid's been pushing on this issue, this neglected issue of sanitation for years. How can it be that 2.4 billion people, 40% of this world, don't have a decent toilet? It just feels outrageous to us, and to everybody here in this room, I know. And yet somehow that really is not being picked up. Why not? I mean, I thought some of the discussions yesterday and also earlier this morning about that were really fascinating. What is it that triggers change? What is it that really brings about new incentive to address these problems? Because Lancet last year came out with an article that the biggest killer of under fives in sub-Saharan Africa was due to poor water and sanitation. The biggest killer of children under 5. And yet still that's not really being picked up and addressed. And that whole question about, is it about politics, people's movements, is it about economics? Do kids just not matter? Why is it not being addressed? Even though, we know 88% of diarrheal diseases, deaths are caused due to inadequate water and sanitation, and the WHO is saying that 50% of people suffering from malnutrition is as a direct result of not having safe water and sanitation. And yet, when you're hearing about nutrition, education, health, water and sanitation doesn't get talked about as a mainstream issue. We've recently conducted some research on what the health sector can and should do about sanitation, and there was a little quote from an official in Nepal, and he said, the trouble is, people listen to doctors, they just don't listen to water engineers. So there's a real message for us, I think, in about how we try and engage more with health professionals and how we can galvanise health professionals in developing countries actually to run on this issue. We know in our own country, in London, that's what made change, and yet that's really not happening. So working across sectors, I think, is increasingly important. One of the other issues, and of course intersectoral collaboration was again one of the principles in the Delhi Declaration. One of the other principles was about participation and the role of women. And as you know, WaterAid has championed. Sorry, I dropped my slides. That's linked back to our research and what came out of the Lancet on diarrheal deaths. Yeah, the role of women. I mean, absolutely critical, as we know, because women and girls carry the burden, literally, of water collection, and it's them that get most affected because of not having safe water and sanitation. We all know that. I was in Ethiopia just 2 weeks ago, and I've seen some pretty awful situations, but seeing women deep in the ground, actually we could only see the tops of their heads down tiny holes in a dry riverbed, getting little cups of water from chipping away at the side of the water table, and then passing those up to the woman above her to then go and fill the jerry can. It was just outrageous, and we obviously heard about how women had died as a result of these little tunnels in the sand collapsing. So women's role, women's empowerment, absolutely critical. And we were hearing this morning of some of the work that WaterAid and our partners have been doing to promote menstrual hygiene and making sure that toilet facilities do have the facilities for washing rags, and that women are talking about this and improving their overall hygiene. Another little example from Ethiopia, I went to visit Arba Minch University in the south, and there was a really inspirational piece of work going on there because the Chancellor of the university was particularly keen to make sure more women got into water and sanitation engineering, and it's a water and sanitation engineering facility. And so WaterAid had been working with him to promote women staying in the course, really helping them so that they come out at the end of the day and we get more women in the profession, which we think is very important. One of the other principles about appropriate technology and management of services again came through Delhi, and of course that's absolutely fundamental to the work at community level. And WaterAid did learn a huge amount from the work of Kalmakara and others about community-led total sanitation. And that really has had a huge effect on our work. And we knew, well, in the early days, I think we didn't realise how important it was. And I think we did help communities build latrines that, just as we saw in the pictures yesterday, got used as a bicycle shed or, you know, for somewhere to sleep or store things. But that was a lesson that we learned, and so throughout all the work on sanitation, that first step, absolutely critical. But picking up on some of the discussions yesterday, sometimes I think the pendulum can swing too far to say, well, it's all up to communities then. And that's not right either. And we know that local governments have got an incredibly important role to play, as have local small-scale private sector providers, in making sure that the sectors are working together so there's sustainable solutions. And we've been doing much more recently in trying to help local government with effective plans, not just for water and sanitation, but for the other elements of their work, so that they really can deliver on the ground. So we're not just helping communities, but we're working with them as well. We also know, though, that that relationship with national governments, both in terms of water and sanitation, but also in terms of the link with the Ministry of Finance and the decentralisation processes, the aid flows, is absolutely critical. And when that's not working, however a strong leader or passionate advocate the local government might be, then it's not going to work. And that's why we're really keen on this Sanitation and Water for All initiative that John Lane spoke about yesterday and hosted by UNICEF. This issue about sustainability, a huge one, and one that we keep coming back to, because WaterAid was built around the idea that we didn't want to just assist organisations to go in, provide services, and then next year they were broken or they weren't working. Community management was clearly an important part of that, and this is about hand pump functionality. But I think the other thing that we've all learnt over the years is that it's not just about technical sustainability, it's about organisational sustainability, it's about people, and it's about infrastructure, and it's about systems, and it's about resources. It's the whole piece. And it's also about the environment, because it's really important that we're making sure that, say, in the latrines communities are putting in, they're not polluting the water table. Finally, the big one around political leadership. The MDG on sanitation is way off track, particularly in sub-Saharan Africa. I think estimates are 200 years before that will be met. That's unacceptable. And we know that where it's worked, where there's been strong political leadership and sustained investment, and I think Duncan gave us an example yesterday, and then we heard examples this morning from Latin America, it's got to be sustained, it's got to be political leadership, it's got to be commitment to getting services to all. Then change can happen. And again, that's why WaterAid's got right behind this Sanitation and Water for All initiative, bringing together finance ministers, ministers for water and sanitation, to really take this forward, not only in terms of political will, but also in terms of accountability, because there's just no mechanism to hold governments to account against commitments, and that's really important. And where I think I felt most inspired by that was when I was in Ghana after the first high-level meeting that was held last year, and met